It's nice to meet you. My name is Dr. Carter, and I'll be working with you in this horticultural therapy program. So my goal today is just to get to know you better and understand what kind of challenges you're going through so we can determine how we can best support you. This is a safe space, and you can share as much or as little as you want to feel comfortable. Does that sound okay?
I guess.
Okay, so to begin, we're just going to start with some basic questions. What's your full name and current address?
Simon at Bedford, and I live at 362 Oakwood in Nova Scotia.
Okay, thank you. And what brings you in here today?
I don't know. My doctor said I should come by and talk to you for some reason.
Okay, so I really appreciate you being here, first of all. How have you been feeling things lately?
Not great, honestly. I could be doing much better.
Okay. And when did these feelings start?
Probably around the time I got into that car accident. It was quite traumatic, honestly.
That sounds really tough. So, can you tell me a bit more about what your days look like right now?
Really not much. I kind of just wake up, try to eat something. Most of the days I don't. And then I just kind of sit around until I pass out and kind of rinse repeat from there.
Okay. So do you have any activities or routines that you go through to bring you comfort?
I used to. I like to, golf. I like to do woodworking. Once in my life I used to like rock wall climbing and all that sort of stuff, but unfortunately, as you can see, I can't really do that much anymore.
That must be really difficult.
And,
So how have your other interests been affected? I noticed that you listed many outdoor interests in your survey.
yeah, I used to like to hike and walk my dogs a lot, get some fresh air. Now I just feel like I just stay inside. I just feel odd all the time.
Well, thanks for sharing that, Simon. I also noticed that you mentioned experiencing phantom pain in your self-report. Can you tell me more about how that feels?
Yeah, nowadays it's just like I try to reach out, try to do things, but I don't get a chance to do that anymore, Many things I used to be able to do with this arm, I just can't do it anymore. It's like a burning sensation I want to try, but I just can't do it anymore.
That must be really challenging. So we'll keep that in mind as we explore some ways to manage it. But right now, let's just shift gears a bit. So how do you think you came to feel this current level of depression?
Because around the time I got into the car accident, as I mentioned before, I accidentally took somebody's life while I was driving, and now I just have that guilt just over my head all the time, and now I just can't forget these feelings, and it just hurts all the time.
So it sounds like you're carrying a lot of pain, both physically and emotionally. Have you had any support in coping with these things from others?
Not really. Family's out of town. I don't got any siblings, no partner. As I said, I got a dog, but that's only can help so much.
I hear you, Simon, and so it sounds like life has been really heavy for you lately. Thank you for being open about that. What do you think would happen if you tried just making little small changes every day, like talking to someone or trying to start a new routine?
I don't know. It might help, but I don't really got people like that to talk to.
That's understandable. Even just showing up here today is a big step, and I really appreciate that you took it. My role is to work with you at your pace, so we can explore ways to make things feel just a little lighter. Right now we're just gathering some information, but based on what you shared, it sounds like some key areas to focus on include managing your phantom pain, addressing feelings of guilt and depression, and finding ways to re-engage with the activities you used to enjoy. That might even bring you just the smallest sense of comfort.
All right.
So, before we wrap up, is there anything else you'd like to know or questions you have for me?
I just want to know if you're able to help me, when can I start? I just don't want to feel like this anymore.
Well, we're just going to take things slowly, but we can definitely book another session maybe next week if you're available.
Yeah, that would be good.
Okay. Thanks so much.
Thank you.